Hello, everyone. My name is Bruce Kamusiime, and I'm presenting contemporary issues in medical education coursework. My registration number is 25HD01 PME/KC, and the supervisor is our dear lecturer, Dr. Bwambale. So today I'm going to start with a question, and the question goes that the government of Uganda decided to merge its main academic regulatory bodies, Uganda Allied Health Examination Board and Uganda Nurses and Midwives Examination Board, UNMEB. They are merged to form Uganda Health Professionals Assessment Board, UHPAB. As the tutor who has witnessed this merger, discuss 8 advantages that have been observed so far and discuss 7 anticipated disadvantages of this merger. So here I start with my background introduction. In Uganda, the training and examination of Uganda health professionals has traditionally been supervised by different academic regulatory bodies responsible for maintaining professional standards in various disciplines. Among these bodies were Uganda Allied Health Professionals Examination Board and Uganda Nurses and Midwives Examination Board, which we are responsible for assessing students in allied health and nursing and midwifery professions respectively. So previously those bodies were independent. So if we add more on this background, it was just a year ago when the government of Uganda recognized the need to streamline the regulatory framework governing health professionals. In response to these challenges, the government implemented structural reform by merging UHPAB and UNMEB to form Uganda Health Professional Assessment Board. This merger is significant. However, like many institutional reforms, this merger has generated both positive outcomes and potential concerns among tutors, training institutions, and other stakeholders in the health education system. So UPAB, or Uganda Health Professional Assessment Board, came in as an act of parliament, which was called the TVET 2025. So today we are going to look at its advantages that I have observed so far, and then anticipated disadvantages of this merger. So let's look at the advantages of the merger that have been observed so far. Number one is harmonization of examination standards. This merger has helped to uniform examination and assessment standards for different health profession programs. Previously, each board had its own system and procedures, but under UHPAB, there is greater consistency on how students are assessed across discipline. So now there is harmonization of how UHPAB and how UHPAB was doing things and how UNMEB are doing their things. So this combination has now brought in harmonization, and we believe there is more standardization. Number two, there is a reduction of administrative duplication. Before the merger, UHPAB and UNMEB operated separate administrative structures, which often resulted in duplicated roles and processes. With this creation of UHPAB and administrative activities such as exam setting, moderation, certification are centralized, reducing unnecessary examination. So now we no longer have duplication of duties. So the other time we used to have the executive secretary of UHPAB and executive secretary of UNMEB, but now we have one executive secretary. So we have taken away the duplication, which has also been cost effective. So there is improved professional collaboration. This merger has encouraged closer collaboration between different health disciplines such as nursing, midwifery, and allied health sciences. So now clinical officers can merge and talk to nurses. There is some cohesion that has been created by this merger. So this has promoted integrated approach in the healthcare. So number 4 of the advantages, improved coordination in health professionals training. So having a single assessment body improves coordination between institutions, regulators, and government ministries. It becomes easier to align curricular, training standards, and examination processes for different health professionals. So now it is easy. Now, for example, inspectors who come to supervise nursing, they also supervise the allied health. So you're going to find that there is improved coordination in training, there is improved coordination, and this one we have seen that it translates into the future. Here there is collaborative professionalism. It is cost efficient to the government. Maintaining two separate examination boards required significant operational budgets. The merger allows government to reduce operational costs related to staffing, offices, logistics, and examination management. I've already talked about this, that you find that now they have to pay only one executive secretary other than paying two. They have to pay maybe a examination officer who is one other than paying two. So it has been somehow cost effective to this government. Then there's now faster policy implementation. When regulatory systems are centralized, it becomes easier for government to implement education reforms and policies affecting health professional training. Changes in assessment guidelines of professional standards can be applied more quickly. So better data management and record keeping. Unified board improves data collection and management for student records. This helps in tracking examination results, certification records, and workforce. So we won't find that the faster policy implementation is that now we can easily make a policy without going through bureaucracy. We have to maybe see the head of nursing, head of clinical officers, head of pharmacy. So there is no bureaucracy. There is no that here and there when passing these policies. Then we have said there is better data and record keeping. Now we have a same centralized system, which is now better than the other scattered system, where nurses had their records and midwives had their records. So we can now keep the best track of how many medical professionals we have countywide. So then lastly, there is strength and quality assurance. So with one central body for assessments, quality assurance mechanisms are strong and more standardized. This ensures that graduates from different institutions meet national accepted competence levels before entering practice. Of course, there is improved quality assurance because now we are bringing the standards of allied health professionals. We are combining them with the standards of the nursing profession. So you're going to find that we have a better and stronger hold as far as maintaining quality and standardization of these professionals. Then let's look at the anticipated dangers of this merger. Number one is increased bureaucracy and slow decision making. A larger centralized board may create more bureaucratic procedures, which could slow decision making, such as exam approvals, results reviews, and curriculum reviews. Yes, much as we said, it has reduced bureaucracy, but somehow, somewhere, to some extent, bureaucracy has been created also. Because you're going to find that these results, they have to be approved by maybe the head of pharmacy, head of clinical officers, head of laboratory, head of nursing, head of midwifery. So you find still there is some level of bureaucracy. Yes. So overburdening of the new board. So the board has now to assume the duties of more than one board. So you're going to find that this new board is facing a lot. So since UHPAB is now responsible for assessing multiple health professionals, the workload may become heavy and potentially affecting the efficiency in one of their duties. Then there is possible delays in examination results. We already saw that one in the June exams. They came late because the new body was doing its best to catch up, but the results came in later. So you're going to find that there is a delay in the release of examination results. So there is loss of specialized focus. Previously, each board specialized in particular field, but this merger might reduce professional specific attention, especially in the discipline that require unique assessment approaches. So the other time you would have a professional body that is specifically for nurses, so they would keep their eye keenly on the nurses. But now this eye has to spread to different professions here and there. So you find that the specialization is reduced. You're going to find that we are no longer focusing at a certain, you're no longer pinpointing at a certain few important details. So we have transitional challenges. Of course, wherever you see a reform, the law of the negation has to come in. Where there is a change, you must have some things that are not put right. So the transition from a double professions to one merger becomes kind of hard. So during early stages, the merger, there may be administrative confusion, and indeed it was there, restructuring challenges and adjustment difficulties for staff, tutors, and institutions adapting to the new system. Then number 6, staff redundancy and job insecurity. Merging institutions often leads to restructuring of positions which may cause redundancy and job insecurity. Yeah, of course, even after combining these two bodies, some people lost jobs because some jobs were not described in the new merger. But thank God the government later called them and they were given other positions. So staff redundancy and job insecurity. So if they tell you that this institution is being sold to the other, expect that most likely is a possibility of losing a job. You become redundant there, you don't know what to do and what and what. Then number 7, risk for system failure affecting all programs. This new merger, we are still trying it. We don't know whether it will work out. There may be a possibility that it can fail. It is an anticipated challenge, but we pray it doesn't happen. Then question 2 is saying, over the past years, there has been a surge of number of health training institutions over a supply of students being trained. As a tutor, how best would you advise the government on generating policies that prioritize quality while maintaining number of schools and their student enrollment? So of course, we have a lot of schools coming in, but how is this one affecting us? Let's look at it. There's a rapid increase in health training institutions. Every day we are having a nursing school, health institution coming up. So, and there has been rapid increase in health training institutions in Uganda and has expanded opportunities for many students to pursue this career in healthcare. However, this growth has also raised concerns about the quality of training, the adequacy of infrastructure, and the availability of tutors and clinical training opportunities. While increasing the number of institutions, increasing the number of institutions improves access to education and helps address shortage of health professionals, the government must implement policies that ensure quality training without necessarily reducing the number of institutions or their students. So here, this question requires me to advise the government. And in my last statement here, I'm saying we are going to advise the government on policies to ensure quality training without necessarily reducing number of institutions or the student enrollment. So advise the government on generating these policies. Number 1, we have strengthening accreditation and licensing standards. The government should enforce strict accreditation requirements for health training institutions. Yeah, the government can decide to put very strict rules as far as licensing these new schools that are coming up. So that wherever, even if it comes in as the best quality. So we have regular institutional monitoring and evaluation. So this body should come in daily and they should monitor the performance of these new institutions that are coming in and make sure that they are moving as per the standards. Then number 3, standardization of curricula across all institutions. So the government has to make sure that all the institutions, including the private ones, they should be following only the same curriculum, not having a private institution running its own curriculum that may not meet the health demand outside. So strengthening tutor recruitment and capacity building. So these new institutions, let them have the right tutor-student ratio to ensure that all students get equitable educational services at their school. So the government should make sure that there is improved clinical training partnership. So the government can come in, look through the memorandums of understanding between the hospitals and between the hospitals and the training institutions to make sure that there is improved collaboration between these schools so that students get enough time on ward without any disturbance. Then number 6, regulating student tutor ratios. And this is a very important gap that we are all worried on. Can now, through accreditation, can the government come out and say to regulate, to start a nursing school, you must have this number of tutors. I understand it has been there, but let the government now be strict on it. That's my advice to the dear government. Number 7, investment in training infrastructure. The government should encourage institutions to invest in modern teaching infrastructure, including simulation laboratories, skills laboratories, libraries, digital learning resources. So the government can come in and enforce these schools, make sure that they have up-to-date training infrastructure, including the e-learning materials and the available AI tools. Number 8, strengthening national examination and competency assessment. So national assessment bodies such as UHPAB should maintain rigorous competency-based examination. So the government can also still bring its shoulder into how these exams are set to make sure that these exams are still, as per the national policy, they meet the required national and international standards. So number 8, use of technology in training. Yeah, we have already said that in the school, in the field there, we're having evolution of the AI, we're having new instruments coming on, we are having technology being reinforced into the health sector. So these schools, they should bring this technology into their hidden curriculum. Then number 10, promoting institutional collaboration. Policies can encourage collaboration among training institutions through shared training resources, joint research, and tutor exchange programs. So the government can also say, if we do not have these tutors, share with this. A school must share its resources with the other to make sure that these students, much as the numbers are increasing, all of them are having access to maybe learning materials by just making institutions collaborate together. In conclusion, in my opinion, the key issue is not necessarily the number of institutions or students, but strengthen the regulation and quality assurance systems. I've been talking about this. If strong accreditation, supervision, and national assessment mechanisms are maintained, Uganda can successfully train a large health workforce while still maintaining professional standards. Expanding training opportunities is very important in improving healthcare coverage, but must always be accompanied by policies that safeguard competence, professionalism, and patient safety. So my references, most of this content was self-generated, and then I read through the Council for Teaching and Technical Vocational Training that was Cultivate Act of 718 of 2006. Then I also looked about technical vocational education and training, that is TVET policy implementation standards of 2025. Thank you so much. Good morning.